Do you know the signs of diabetes that can appear at night? It's a question that might not come to your mind regularly, but understanding the symptoms of this common yet serious health issue can make all the difference. Today, we explore the subtle yet significant signs of diabetes that often manifest at night. These nighttime indications provide valuable information about potential underlying health issues. Firstly, one of the early symptoms of diabetes often manifests as increased urination. If you wake up several times during the night to empty your bladder, your sleep pattern might be disrupted, which could potentially be a sign of diabetes. This happens because when you suffer from diabetes, excess sugar or glucose accumulates in your bloodstream. Your kidneys have to work overtime to filter and absorb the excess sugar. If the kidneys can't keep up, the additional glucose is excreted in the urine, drawing fluids from your tissues, which increases the frequency of your urination. This physiological response is your body's attempt to eliminate the surplus sugar and could be an early warning sign of diabetes. Secondly, night sweats are another crucial symptom to consider. If you frequently wake up in the middle of the night sweating, it could be an indicative sign of diabetes. Night sweats generally occur due to low blood sugar levels at night, known as nocturnal hypoglycemia. This happens when your body releases emergency hormones in response to low sugar levels, leading to excessive sweating. Adjusting medication dosages and dietary habits can also help manage night sweats in diabetics. However, these changes should only be made under professional supervision. Before moving on to the next symptom, don't forget to like and subscribe. Thirdly, symptoms of hypoglycemia, including not only sweating and trembling but also a notable increase in hunger, confusion, blurred vision, and even heart palpitations, can occur at night. Hypoglycemia, or low blood sugar, is a condition often associated with diabetes. The reason these symptoms mainly manifest at night is due to the body's need for energy while at rest. When glucose levels drop, the body responds by displaying these symptoms to signal the need for increased blood sugar. Managing these symptoms involves regular blood sugar monitoring and a balanced diet. Additionally, it is crucial to discuss any medications with healthcare professionals, as some medications can affect blood sugar. In some cases, a nighttime snack containing complex carbohydrates and proteins may be recommended to maintain stable blood sugar throughout the night. The fourth sign is restless legs syndrome, a neurological disorder that is often underestimated but quite common. This condition is marked by an uncontrollable and irresistible urge to move the legs. This urge is often accompanied by strange and uncomfortable sensations deep within the legs. The sensations, quite difficult to describe, have been likened to aches, tickling, or even a frightening feeling. Now, you might be wondering about the link between this syndrome and diabetes. The link actually lies in the nerves. A persistently high blood sugar level, characteristic of diabetes, can damage the nerves in your body over time. This condition, known as peripheral neuropathy, is a common complication of diabetes and can lead to the onset of restless leg syndrome. Damaged nerves send conflicting signals to the brain, leading to the sensation of constantly needing to move the legs. So, if you experience discomfort or an irresistible urge to move your legs, it might be a good idea to have your blood sugar checked. The sleep disorder known as sleep apnea takes the fifth spot on our list. It is a sleep-related condition characterized by frequent breathing pauses during sleep. These pauses or apneas can occur multiple times throughout the night, leading to interrupted sleep and often leaving the individual tired the next day. The link between sleep apnea and diabetes is particularly notable. Scientific research has shown that people with diabetes, particularly type 2, are much more likely to suffer from sleep apnea. The reason behind this is multifaceted. A key factor is that both conditions are associated with obesity. When excess fat accumulates around the neck, it can obstruct the airways, leading to sleep apnea. Additionally, the metabolic disruptions caused by diabetes, such as insulin resistance, can directly contribute to the development of sleep apnea. Insulin resistance can cause imbalances in the body's energy consumption during sleep, leading to breathing interruptions. It is this complex interaction of factors that results in a higher risk of sleep apnea in people with diabetes. Moving on, we come to the symptoms of increased thirst, also known as polydipsia. If you frequently wake up at night with a dry mouth and feel unusually parched, it could very well be a telling sign of diabetes. This occurs due to high blood sugar levels, which force your kidneys to work overtime to filter and absorb excess sugar. When they can't keep up, the excess sugar is excreted in the urine, drawing fluids from your tissues, which triggers more frequent urination. This can dehydrate you, hence the increased thirst. Managing this particular symptom involves controlling your blood sugar, regular monitoring, a balanced diet, regular physical activity, and medications if prescribed by your doctor. It is essential to consult your doctor to learn the best ways to manage your symptoms. Do not ignore increased thirst, especially if it is accompanied by other symptoms of diabetes, as it is your body signaling that something is wrong. The seventh sign to watch for is fatigue. If you constantly feel tired despite essential hours of sleep, it could be an indication of diabetes. Fatigue associated with diabetes is due to the body's inability to effectively use glucose as an energy source. When your body cannot convert food into energy due to a lack of insulin or insulin resistance, you might feel constantly tired. This is because the cells are deprived of the glucose they need to function optimally. Managing diabetes-related fatigue involves maintaining stable blood sugar, which can be achieved through regular physical activity, a balanced diet, and regular checkups with your healthcare professional. It is important to ensure your body gets enough rest and that stress levels are kept to a minimum. Relaxation and stress management are also crucial in managing diabetes-related fatigue. Dry mouth, medically known as xerostomia, is another notable symptom to be vigilant about. Characterized by a lack of saliva, individuals may frequently wake up with a dry mouth despite maintaining adequate hydration levels. This could potentially be a sign of diabetes. This symptom occurs because high blood sugar levels can decrease saliva production, leading to a dry mouth. High blood sugar can also cause increased urination, which can lead to dehydration and subsequently a dry mouth. Managing this symptom involves maintaining good oral hygiene, staying well hydrated, and using saliva substitutes or stimulants if necessary. Chewing sugar-free gum or sucking on sugar-free candies can also help stimulate saliva production. Consulting a healthcare professional is always recommended for accurate diagnosis and treatment of this condition. The final point to note is the occurrence of sleep disturbances. If you suffer from insomnia or face other nighttime agitations, this could likely be related to diabetes. Chronic sleep disorders are often observed in diabetic individuals due to the body's inability to regulate blood sugar, leading to nocturnal hypoglycemia or hyperglycemia. Hypoglycemia can trigger symptoms like sweating and trembling, which can wake you up in the middle of the night. On the other hand, hyperglycemia can cause frequent urination, leading to multiple trips to the bathroom at night. Managing these sleep disturbances generally involves better blood sugar control through medications, dietary changes, and exercise. Therapies such as cognitive behavioral therapy can also be beneficial in combating insomnia. Therefore, if you have trouble sleeping, it is essential to consider the possibility of diabetes and consult a healthcare professional for a precise diagnosis and treatment. In summary, the signs of diabetes that can appear at night include frequent urination, night sweats, symptoms of hypoglycemia, restless leg syndrome, sleep apnea, increased thirst, fatigue, dry mouth, and sleep disturbances. Remember that these symptoms do not constitute definitive proof of diabetes, but they may indicate the need for a medical consultation. It is always preferable to consult a healthcare professional if you experience any of these symptoms. Diabetes is a disease that affects millions of people worldwide. Being aware of the signs, especially those that occur at night, can aid in early detection and management. Don't forget to like and subscribe if you enjoyed the video.